So now in your paper, you described some data suggesting that helping depressed patients recall positive things or imagine positive things wasn't always so helpful, and it sometimes, in fact, led to an increase in negative mood, if I'm remembering it properly. Can you talk to us about that?
Yeah, so Jutta Yorman and others have done some really beautiful work looking at if people are simply asked to be positive, it can actually lead to mood deterioration. So I think her paper had a lovely title, something like The Blues. So I think what's really interesting is if we present people with stuff that's just positive, and we all know this, we say verbally, then it can have a negative effect when one's in a depressed mood. So all sorts of things start happening, like it used to be positive then, but it's not now. It might be positive for them, it's not for me. So kicking off a ruminative chain of thinking. Now, I suppose rumination and verbal processing invites that kind of what we might want to call comparative style. And I guess this deterioration, in fact, the opposite, gaining from positive information, can happen in imagery mode. So because we know that imagery can feel more real, if you present positive information instead in an image-based form, like rather than, did you have a nice time when you last went on a holiday? Yes, it's all very nice, but it's awful now. I'd like you to imagine your last holiday. Tell me about that time you were on the beach. What did it feel like? What did it look like? Bring out your mind's eye vividly. It's giving people that bit that's always saying no and comparing verbally a chance to go back into episodic memory, imagery-based processes, and a more experiential form of memory rather than that sort of combative verbal ruminative kind of memory.
Okay.
Does that make sense?
Well, let me tell you what I'm hearing, which is you're suggesting there is some data that you present in your paper that if, summarizing work from Jutta Jorman, you're saying that if we have depressed people, and I'm thinking of a patient I saw in my office yesterday, if she recalls her marriage, which broke up, then she'll say, oh, I was so happy then, but look at my life now. It's horrible. And so it seems to trigger rumination and comparative thinking that pulls her mood down.
Exactly. That's exactly it. Yeah.
And you're suggesting that one way to work around that would be to spend a little more time on actually eliciting a sensory visual memory of the happiness that she had before to make it more real and try to interrupt that comparative thinking. Is that what you're suggesting?
Well, I guess imagery doesn't invite comparative thinking in the same way. So what our heads do with words, that's why philosophers or, politicians have arguments or people argue in words. You can do a lot of combative, comparative stuff in words, which just an image-based mode doesn't do. So it might be that if your goal in the session was to focus on enhancing positive mood at that moment, then focusing on that positive information in an image-based form may be beneficial. And suppose it's about here and now positive thinking and just testing that out and certainly lessening the amount of verbal comparative thinking.
Yeah.
So, and I think it's hard because in the situation of the past, and there's a truth value to it. Things are more difficult now, but a nice place to start might be perhaps even with smaller things. So, I got some good news this morning in the post, but it didn't even make me feel happy because I just knew it would all get bad again. But actually, just allowing someone to savor a small positive in the here and now by imagining it getting more involved helps boost little tiny experiences of positive affect, or I think Simon Blackwell used the term positive flashes in everyday life. We need just tiny moments where we savor positive things, even though all these other cascades and processes also continue sometimes.
So that idea of these small positive flashes in daily life, I think that our depressed patients are not spontaneously having. These kinds of interventions can be very powerful, I think, to help the person. Like I get out of bed, I think about my coffee, and I wasn't.
Yeah, me too.
I don't know that I have a visual image of it, but maybe I do, and it's part of the being able to imagine these things that help me get energized and motivate my behavior and move me forward. And so, helping our depressed patients get those flashes of positive
everyday positives.
Positives. And part of what you're saying that I think is worth highlighting is the visual image is more tightly tied to emotional experiencing than verbal thoughts. And just that idea alone, I think, has huge therapeutic potential for clinicians to use.